You join a church. You don't know what you're getting into. Whatever you're doing in life, you go to college. And do you know what you're getting into? No, you don't know what you're getting into.
Very true.
You join a church. You don't know what you're getting into.
Oops.
Whatever. That's
Ugh.
what I said.
I know it's repeating. I got us live on YouTube, everyone. No worries. Uh, in case you are hopping in late, or you want to see last week's episode, or maybe you want to watch an episode from 2 years ago, guess what? They're all recorded. They're all on YouTube, so you'll be able to find them at our Barton channel there. And I'll post a link to that, but you can find it at bartonwebinar.com. Lots of good stuff in store for you today. So I'll just kind of keep repeating this for a couple more weeks, just so that you guys are aware. We have kind of revamped this webinar. So this is our Wednesday webinar, and we are going to be talking about type 2 diabetes and heart health. And so both of those topics will be discussed we'll rotate them. They'll be discussed on this webinar. And then our Thursday webinars is where we talk about home cures that work. And what that means is this is a publication that has been around for a long time. Dr. Saunders has helped write for it. It's been a Barton product, I guess, where we talk about different health issues that maybe don't fall into the specific category of heart health or type 2 diabetes. But they may be things that you're curious about, or you want to learn about, or they could be affecting family members, or whatever it is. We wanted to kind of have that Thursday webinar be dedicated to other interesting health topics. And so we've talked about a lot of fun things, and we have more in store. And we're going to pick some of the things that Dr. Saunders has already written about in the Home Cures That Work magazine, so that you guys can get some of that information for free, which maybe I shouldn't tell you that, but it's going to be fun, and we're excited that you guys are here. So just so that you guys are aware of that, if you want more information about our webinars, you can go to bartonwebinar.com. All right, so today is going to be good. I want to quick put this disclaimer out that Dr. Saunders is a doctor, of course. He's a wonderful doctor, but he is not your doctor. And so the things that we talk about today, we just recommend that before you implement any of them, you do discuss them with your healthcare provider. So we talked about more specific heart things last week, and so this week we're going to talk a little bit about type 2 diabetes. And it's fun to get feedback from you guys. Our emails and the things that you're asking about on the webinars has kind of led us to this topic for today. And so we're going to talk about some surprising signs of type 2 diabetes. And as I was doing a little bit of research for this, there were some weird things that I saw that I am really curious about. And so I'm excited to ask Dr. Saunders about this. These are things we've not talked about, or I've heard some of you talk about, maybe have been mentioned, or we're seeing people mention this in other places. So I want to just kind of go through it. So these are some of the surprising signs of type 2 diabetes. This is what I have found in my research. So we're going to ask Dr. Saunders about them. Okay, so here is a surprising sign of type 2: sudden weight loss. Let's talk about that. Is that even true?
Okay, with type 2, that's pretty unusual, but it does happen. And so if you're like gaining weight, and all of a sudden you lose weight and you're wondering why am I suddenly losing weight? Sometimes it can be because you decrease the amount of insulin. So, or you have a lot of insulin resistance, and all of a sudden you're using up your fat for energy. Another reason why type 2 people sometimes get weight loss is because they get something called gastroparesis. And that means the stomach just stops working. Paresis is like paralysis. It's paralyzed. It just goes, and it's not pushing things through and grinding up your food and everything anymore. And so you're just not hungry, and you just don't eat as much. And so all of a sudden you start losing weight. And so weight loss is not normal. People should not lose weight. So if you're losing weight, that's a bad sign usually. If you're trying to lose weight, that's good. And you're eating less, you've changed your diet or something like that, that's okay. But for people who are just eating normally or just doing what they normally do and they start losing weight, you need to know why. That's not a minor problem.
We do have a lot of people that hop on and they have great success with the program that Dr. Saunders and the Barton team has put together, called the Diabetes Solution Kit. You can find that at bartonwebinar.com. What happens sometimes is people say, I've lost great weight on this. My numbers still aren't where I want them to be. What do I do with that?
That's a tough problem. I actually have a patient with that right now. She's like doing phase one, and she started measuring ketones because her blood sugar wasn't going down, and her blood sugar just would not come down. And guess what it turned out to be? Adrenal. She's making all this extra cortisol from her adrenal glands, and that makes her insulin resistant. So her insulin's going to be, or her blood sugar is going to be high. So her glucose is continuously high, even though she's not eating any at all. In fact, at one point she did what's called a, I've never even heard of this, a anchovy fast.
Ooh, that sounds terrible.
Where you only eat anchovies and nothing else.
Okay.
And she still had high blood glucose. I'm like, what the heck? So we did some tests and found out it was an adrenal problem.
Wow, very interesting. I'm glad we didn't include that in our book.
So how would that work, Dr. Scott? I'm curious, like the adrenal, because I know like our liver will pump out glycogen, I think, into our blood, like in the morning, the dawn effect. But like, how does that work biologically with the adrenals?
Well, it's the same thing. It's like having a dawn effect continuously all the time. And so you're always pumping out glucose, and you're always resistant to insulin. And the resistance from the insulin is for the muscle cells and the fat cells. And so the blood glucose is just continuously elevated.
Where is it getting the glucose from?
From the liver. The liver does two things. Either it's taking the glycogen and breaking it down, like you said, making it into glucose, but it also can take protein and take it out and make it into glucose.
So if she fasted and like didn't eat anything, would it go down, or?
It would help because fasting suppresses the adrenal output, unless she has an adrenal tumor, which we don't know yet. So it could be an adrenal tumor, in which case she's just going to have the gland that has the tumor removed.
And would your body ever turn muscle into glucose?
Yes. Yeah. So muscle has something called glycine in it, and the glycine is made into glucose. And so when you're getting really low on glucose, then your body will take it wherever it can, and that includes muscle. And so in order to avoid that, one of the things to do is, if you're working out, if you're using your muscles, then those muscles won't be used, they won't be taken. Whereas if you're just relaxing on the couch all the time and going, well, I'm not eating and I'm not hungry, so I'm not going to eat, and I'm not going to eat, and I'll just lay on the couch because I don't have any energy because I didn't eat. Well, a lot of people say that and say, oh, I'm fasting, I can't do anything. No, you should, so that you're not using your muscles to make glucose.
Good stuff.
Okay. All right. Surprising signs of type 2 diabetes. We did sudden weight loss. How about unexplained mood changes?
Oh, yeah. Okay. So one of the things that happens is when glucose goes up, then there's extra glucose, extra insulin around to get into the brain. But then when glucose drops down, so if there's like this normal variation, as it drops down, you have less glucose transport proteins to get glucose into your brain. So your brain starts starving for energy. And do you know how you feel like if you've ever been fasted, you get what's called hangry. That's hungry, angry at the same time. And that's the kind of thing. The moods can change because as the blood glucose changes and you're getting relatively low blood glucose called hypoglycemia, even if it's high, if you were to test it and it's like, say, 200, but if normally you're 300 and you drop to 200, you could get mood changes just from that because the brain has less glucose in the to use for energy.
All right. Let's do another sign of type 2 diabetes. Pain in arms and legs.
Yeah, so pain like in the hands and feet or arms and legs is fairly common, and that's neuropathy. So the nerves that are the longest nerves are the ones that are going to first notice the lack of energy. So when you have type 2 and you don't have enough energy getting to the nervous system, the ones like in the toes you notice first: tingling, numbness, pain, burning sensation. Sometimes it's really hard, like at night, you're trying to go to sleep and you got these pins and needles poking into your hands and feet. It usually starts in the feet, and if it gets up to around the knees, then you start noticing it in the fingers, because it's the length of the nerve, and the nerve from like your toes has to go all the way from your back all the way down your leg to your toes. And so that's a long nerve. And then the ones from your arms have to go from your neck all the way down to your fingers. And so it's the length of the nerve is the reason why that's noticed first in those areas.
Okay, another surprising sign of type 2 diabetes, vomiting and nausea.
Yeah, when there's changes in the blood sugar, sometimes the stomach doesn't work very well. And it's called gastroparesis, and it's one of the reasons why people lose weight too. But if it gets really bad, if you get gastroparesis and it just doesn't work, then things don't move through, and then you get nausea, and it'll all come out the wrong way because it's not moving through the intestines the way it's supposed to. So it's kind of a surprising sign, but it could come from type 2, and it's not that uncommon.
All right, another sign, blurred vision.
Yeah. Okay, so many of you have experienced blurred vision from type 2. If you have type 2, you may have experienced this. This is fairly common. When the blood glucose goes up, the osmotic pressure changes, and your eyeball is actually growing and shrinking and growing and shrinking. And so your vision is changing because of that. That's an issue. That's a problem. But it's not damage to the eye. It's just that the eyeball is growing and shrinking, and that changes the vision. It blurs your vision. So a lot of times an eye doctor, if you go to an eye doctor, they'll tell you, don't get glasses until your blood sugar is stable. Because if you come in, your blood sugar is really high, then you're going to have your pair of glasses. Oh, they look great. And then you're going to get back, your blood sugar is normal, and you're going to go, these glasses are terrible. They don't work.
Okay, lots of questions coming in, which is wonderful. If you can post those in the Q&A, that would help me immensely. Thank you so much. Okay, another surprising sign of type 2, dark skin around the neck.
Yeah, this is interesting, and it's fairly common, especially people who have pigment in their skin. They tend to get darker skin around the neck, and that is a common sign. And also, they get skin tags. So you see that it's extra melanin that's being produced wherever there's inflammation in the skin. But very commonly around the neck or around the armpits, you'll see that.
All right. How about another surprising sign of type 2 diabetes is recurring vaginal infections?
Yeah, so yeast infections are not really that common, and when they happen recurrently, then you have to ask the question why. And so the thought is with type 2, the blood sugar being really high, all of that glucose being there, the secretions that everyone normally makes, women make, the vaginal secretions will have extra glucose in them, and that feeds the yeast. So then you have it. So you get rid of the yeast infection, and then it comes back. Why? Because they have food. They have glucose, and as long as there's glucose there, then that's going to grow back. So having normal blood sugar should prevent that from happening.
Okay. And our final surprising sign of type 2 diabetes is fruity smelling breath.
Yeah, fruity smelling breath. That is when you're in ketosis. So those are the ones that are having really bad problems, and are not. See, when you're doing our program, for example, if you're doing phase 1 of the Diabetes Solution Kit, you're going to do what's called a ketogenic diet, and that lowers your blood sugar because you're not eating glucose, you're not eating sugar at all, or just 20 grams of it, a very small amount. So you start making ketones. Your liver starts taking fat and making ketones so that your brain has energy to use, and heart and other organs have that energy to use. So if you cannot use glucose properly, for other reasons, from like severe resistance, insulin resistance, for example, then your liver will start making ketones, and then you get that fruity breath. And that's people who do a ketogenic diet, they're often told that they have bad breath. But it's not like the usual bad breath. It's got a different kind of a smell. It's fruity. That's why they call it that. It's ketones.
Interesting. All right, I want to dig into some of these questions here. So I'm going to read these out of the Q&A. If you can post your question there, that'd be great. On YouTube, you can comment, of course, and same with Facebook. All right, John said, I have itchy skin over much of my body. Is that a symptom of type 2 diabetes? Regardless, how do I best treat it?
Okay, so fishy skin, like scaly skin, like that. Itchy skin. Okay, so itchy skin is not a sign of type 2 specifically. So why is your skin itchy is the question. And it's often because of histamine. If they do inject histamine under the skin, and histamine is a neurotransmitter, and it's normally used, it's found in food, it's a common thing. When they inject it under the skin, then they just scratch. It's just like so itchy. They just want to dig their skin out, and they will literally make lesions in their skin, like dig ulcers into their skin, from the itchiness from the histamine. So itchiness is generally caused by histamine. So then the next question is why? Why is the histamine there in the first place? And it's often because of allergies. And it's not specific to one thing. So it's not like like it's always one thing. It could be pollens that you're breathing in and taking in, and then that makes you hypersensitive in your skin, and so your skin gets really itchy. Could be food that you're eating. It could be that you have histamine intolerance and you're not making an enzyme called DAO, diamine oxidase. Or another one called HNMT, histamine N-methyltransferase. Those enzymes break down histamine pretty quickly, like in seconds. So histamine lasts for seconds, and if you don't have those enzymes to break it down, then it lasts for minutes. It still does go away, but it's around for a lot longer, so your levels are a lot higher, and then that causes hypersensitivity. As if you were having an allergic reaction, and it may not be an allergic reaction. So what would cause that? Well, stress causes that, as a matter of fact. That's the funny thing, that when you have a lot of stress hormones, cortisol, it blocks you from making DAO or HNMT. So you tend to get more histamine produced, which is great for stress because it wakes you up. And that's so because histamine is a wake-up hormone. It tells your brain, it wakes your brain up, and it gets you going, right? It's kids that have histamine intolerance, their histamine is so high, they're like, they're wired all the time, they can never sleep. And then they take a histamine blocker, like an antihistamine, and they go right to sleep immediately. Boom. So a lot of people, when they have itchy skin, they take antihistamines for that reason. And that's one way to do it. But really what you want to do is look for why. Why is that histamine there? Or do you have allergies? Is it pollens in the air or mold or something that you're breathing in? Or is it a food that you're eating that you're sensitive to? Or is it you're under a lot of stress? All of that could do it.
Okay. David said, I have type 2 diabetes with some kidney effects. Lately, I have suffered body itching. Is this related? I understand it can reflect kidney damage. What treatments are available?
Okay. Well, depends on the level of kidney damage. So the idea of this connection that people make with the itching in the kidneys isn't from mild kidney damage. If you're on dialysis and you're uric acid and creatinine levels and what's the other thing? Ammonia levels. So if the nitrogenous waste level gets really high, you can get deposits and get itching and problems from that. But that's usually people who are on dialysis. They're really sick and their kidneys aren't functioning at all. If you just have a decreased kidney function, that's not likely to be an issue. So what to do about it is to find out why. Because first of all, fix your kidneys. You don't want to lose your kidneys. If they're just mildly impaired, then do phase 1 of the program and make sure that you get your insulin resistance down so you're really insulin sensitive so that your kidneys have plenty of energy to function with. That's number 1, is fix the kidneys. Number 2 then is to find out why you're itching, what you're sensitive to, what you're reacting to. And that may require some tests for even allergies or DAO. I've tested for that too.
Okay. Sandra says, how long to wait after exercise to take your blood sugar reading?
Oh, you don't have to wait. You can take it right after exercise. And that's really interesting then to know what it is right after exercise, but you don't have to wait.
Okay. Michelle says, does eating cheese, peanut butter, and lots of nuts cause glucose to be high the next morning?
It can. So peanuts do have carbs in them significant, and most nuts have some carbs in them. They're not really high. And then with the cheese, protein. So you're eating carbohydrates, fats, and proteins, and that's kind of a concentrated, high calorie kind of thing. So yeah, your blood glucose can certainly be high from that.
All right. Beverly says, so what do you do? How do you help the patient? Okay, was that, I'm not sure what that was.
Was that the kidney issue or itching or
Oh,
both?
no.
Okay.
I don't know. I'm sorry, Beverly. I got to it too late, I think. Okay. Label Gang says, my fear is to go blind due to type 2. What signs should I look out for indicating that I'm losing my sight? Good question.
Okay, good question. Okay, so going into an eye doctor is one of the only ways to know, because the doctor can look in your eyes, they dilate your eyes, and they look at the retinas. And when they see spots on the retinas or areas, they call them cotton wool spots. There's areas where the retinas are swollen or non-functional, or they don't have a good blood supply, or they have excess blood vessels going into them because they're not getting enough energy. And the eye doctor can see that. So that would be something that the early signs would come from an eye doctor. But the most important thing is to get your insulin sensitivity up, to be really insulin sensitive, so that your retinas can have the energy that they need and you won't lose your vision.
All right. Stefan says dry mouth, especially at night when trying to sleep.
Yeah, dry mouth is often due to, well, not enough fluid, but sometimes when the blood sugar is really high, then it causes you to release a whole bunch of urine into your kidneys and you become dehydrated pretty easily. The best way to deal with dry mouth, oh, there might be another thing, and that is making sure you get enough salt. Because if you lose too much sodium, people who drink too much water, they often lose sodium and they get dehydrated, and then they'll have dry mouth at night too. So getting the glucose under control and making sure you get enough salt.
Okay, Beverly had said, bit itching can be dryness or even a sign of healing, and some cancer patients get very itchy. So yes, investigate. Thank you, Beverly.
Yeah.
Let's see
Cancer
here.
patients, liver problems, the toxicity from the liver not detoxing can cause itching. Yeah, there's a lot of things.
Okay, Bev says, when one has a horrific reaction to poison ivy and needs a shot, does this pertain to histamine problems?
Maybe. Yeah, poison ivy is something that causes a reaction, but it's not the same as it's a type 4 allergic reaction. It's a different type of allergic reaction, and so the shot really is just to stop the swelling. It doesn't really even stop the reaction, but it does stop the swelling. The reaction will continue on. It usually goes on for a couple of weeks, no matter what you do.
Right. Okay. So I think this came up last week too. What can you tell me about zeolite to add to food and how does it work? I think that was, it said that it helped to detox, right?
Yeah. It's a zeolite is a isn't it a
I'll look it up.
like diatomaceous earth, like a clay. Yeah, and I think it's for organic toxins. I don't know if I would add it to food though.
Yeah, I don't, it's come up a couple of times. I don't think we know a whole lot about it. Because I think it's digestive and cellular detox. It scrubs toxins from the body. This is the stuff it says it does. Fast, effective detox. I think one of our partners, they may be one of our partners. I'm not sure. Okay, I'm going to go to another question. Patricia said, I read an article recently that said if you supplement with 1,000 milligrams per day of vitamin C, there's a significant reduction in glucose after meals and lowers average blood sugar levels. When I change my Freestyle Libre every 2 weeks, it displays a message not to take vitamin C. Why?
Vitamin C is brought in to the cells the same way glucose is. In fact, most animals in the world make glucose into vitamin C. I don't know if the machine actually can distinguish between vitamin C and glucose, and that might be the issue. That if you take a bunch of vitamin C, then the machine's going to calibrate wrong because it's looking at it as glucose. I know, like for example, when we do cancer treatments with high dose vitamin C, we use an intravenous vitamin C, and the cancer cells take in vitamin C the same way glucose. It's the same glucose receptors that bring the vitamin C into the cancer cells. So I wonder if, like, the machine doesn't distinguish between vitamin C and glucose.
Interesting. Okay. I'm going to go back to some of these questions that were in the chat. Okay. I have the following question concerning heart health pertaining to the consumption of salmon. Is it healthier to consume Pacific or Atlantic salmon? And is it advisable to eat farmed or wild salmon?
Okay, good question. All right, I've done some research on this, and as far as whether it's Pacific or Atlantic salmon, generally the Atlantic salmon is going to be farmed. The Pacific is generally wild caught. It's not all true, but that's the usual. So I prefer Pacific salmon, and then we're back to the wild caught versus farmed and what's better. Whatever the salmon eats is what you get in the salmon. So you eat the salmon, and you're getting whatever the salmon eats. And so they're feeding farmed salmon on things like grains, and as part of their feed, they have grains. So the omega-3 to or omega-6 to 3 ratio is not as good in farmed salmon as it is in wild caught salmon. And so I tend to prefer the wild caught salmon. Also, there's more astaxanthin. In the farmed salmon, they use colorings to color the meat red. They give them dyes to color the meat red, whereas in the wild caught salmon, they're getting astaxanthin that makes the pink color in the fish.
All right. Dan wants to know how to reverse my diabetes.
Ooh, we have a whole book on that. So to reverse your diabetes, what you want to do is first know what you have. So the first thing to do is do the 4 tests. Do your glucose, insulin, C-peptide, and hemoglobin A1C. And that's the short-term and long-term for the insulin and glucose to see how much insulin resistance you have. And then if you have high glucose and or high insulin, then you have a lot of insulin resistance, and you just go into the first page of the book and answer the questions, and then go to phase 1 and start on phase 1. And that's a very good way to reverse diabetes. If you have really low insulin, then you may need to see an endocrinologist and start getting some tests to find out why you have low insulin. Do you have autoimmune problems with the pancreas or other pancreas problems? And that can often be done by an endocrinologist.
All right. How can you slow or stop neuropathy?
Okay. Number 1, first thing to do if you have neuropathy, find out why. Why is the neuropathy there? If it's something like diabetes, then you have to control that first. You have to control the insulin resistance and get insulin sensitive. If your neuropathy is due to lead toxicity, then you need to remove the lead. And look out for where that lead is. Where are you getting it from? Or mercury or whatever heavy metals could be causing that. If you have a deficiency of a nutrient like folic acid, vitamin B12, then you need to deal with that. Why do you have that? And do you have an absorption problem? Do you have a problem with your stomach? The stomach is really important in digestion, but also absorption. If you don't make intrinsic factor in your stomach, then you won't absorb vitamin B12 in very good amounts. And you could end up deficient in vitamin B12, even if you're taking pills and a whole bunch of vitamin B12. You may not absorb it if your stomach isn't making the intrinsic factor. And some people take things like omeprazole, for example, that cause the stomach to stop making intrinsic factor, and then they get deficient in vitamin B12. So some of the medications can do that, can cause deficiencies. So looking for the source of why the neuropathy is there, and then fixing the source. So if you have a vitamin B12 deficiency and you're starting to get neuropathy in your hands and feet, and then someone tells you, oh, that must be due to diabetes, and so then you go on a special diet and everything, that's not going to fix your problem. And you'll call us or come on our program and say, I've been doing this diabetes kit for 3 months and I still have neuropathy. Well, that's because that wasn't the reason you had neuropathy. You have to deal with the reason it's there. So testing is a good way to find that.
Well, and Peter said, is there a way to reverse neuropathy caused by chemo treatments?
That's difficult. I have not had a lot of good luck with that. I've had a lot of patients who've had chemo and have neuropathy, and I've tried them on Nervala. I've tried them on ketogenic diets. I've tried them on all of the nerve repair stuff, and you know what? It just takes an awful long time for nerves to repair. But building up mitochondria is one of the important things, and I've found that supplements and I've had people who've gotten better, but it's incremental improvement. It's not like, oh, I got better. Like we have some people come on our program here and they say, oh yeah, I started under Vala and the next week it was all gone. I'm like, oh wow, that's what I expected, and it doesn't always happen that way.
All right. Let me see. When is a good time to take berberine or Nervala?
Berberine or Nervala. With food, it doesn't. The time of day probably doesn't matter much. Everything is better processed in the morning. So if you eat in the morning, then all the liver processing and everything that needs to happen happens really nicely in the morning. If you wait till the evening to take things like berberine, even Nervala, vitamins, stuff like that, the liver has less capacity in the evening to process them.
I love this question from Melinda. Is ashwagandha good for stress? How much should be taken, and when is the best time to take it?
Okay. Ashwagandha has been well researched for stress. Yes, it's good. It is an herb that's been around for, of course, thousands of years, that has been used for stress for thousands of years. And it's not it used to be called Indian ginseng, I think, but now ashwagandha has its own designation. And it's been studied in like Alzheimer's disease, and it's really useful. So how do you take it? Well, that depends. If you're taking a whole herb, it's an entirely different thing than if you're taking an herbal extract, for example. And so it depends on how it comes. And so because it's an herb and it can be processed differently, it's important to look at the way it's processed and use the recommendations by the manufacturer. That's what I generally do.
Let's see here. Eve wants to know what you can tell us about xylitol and how it works.
Okay, xylitol is a sugar alcohol, and it's actually glucose, and it's an alcohol of glucose. So it's pretty, it's sweet. It tastes sweet. The problem is it's taken up as sugar and can't be used by most of the bacteria. It kind of messes up your colonic bacteria. So you can put it into like your nose and stuff, and it gets rid of the bacteria in your nose too, or the xylitol gum, people chew gum, and it kind of gets rid of the bacteria in the gum, because the bacteria take it up as if it was glucose, but it's because it's reversed, they can't use it. But we can't use it either. And so it can mess up your bacteria. But here's the problem. If you have type 2 diabetes or insulin resistance, and you start chewing xylitol gum, for example, your pancreas thinks that there's a bunch of sugar coming in and puts out insulin, and then you get more and more insulin resistant. And so it's not a healthy thing to do.
All right. Rose says, I've been on the diabetes reversal program successfully for almost 3 months, lowering my A1C from almost 10 to 7.1. I've been taking 10 supplements from the program, and I've been getting some stomach pains, even when I know I've eaten the right things. Is it possible I shouldn't be taking all of the supplements?
Yes, that's possible. So how do you know? Test it. Go off one of them, see how it goes. No, that's not it. Go off another one, see how it goes. No, that's not it. go off. Oh yeah, I feel a lot better. That's the problem one right there. Yeah, you got to find out. You got to test that, and you can test them one at a time. The other way to do it is to go off all of them, and if you're then feeling better, you go, oh, I'm feeling a lot better. Then you can add them back in one at a time, and see which ones you can actually tolerate and which ones you don't.
Okay. Let's see. Anonymous says, I would like to start the diabetes solution. I've been taking metformin for years. Can I stop it while I'm trying your program? I have your book and Cinechroma already.
Yeah. Okay. Well, metformin has its risks and its benefits, but it doesn't have like, it's not something that's going to make you better. It's just like a temporary way of lowering blood sugar. So it's not essential. You're actually better off doing the program without the metformin because it allows you to use your glucose and the fat to change to fat burning metabolism easily. Yeah, so I don't know. You should talk to your doctor about that, but I wouldn't think it would be necessary.
All right. Patricia said, another question. Does taking a teaspoon of extra virgin olive oil help in stable blood sugar? First of all, am I the only one who does not like the taste of olive oil? I just really, really don't. It's so hard for me. I use it in
Huh.
like salad dressings and stuff, and I'm like, oh, I just can't do it. It's not
Oh,
my favorite.
that's interesting. Do you like olives? Just like
Love
green?
olives. Love them.
Really?
Yep, all of them.
Black olives, green
Yep,
olives. You're
yep.
good. But olive oil you don't like.
No, I
That's
know. I kind of wonder, you know how some people have the weird thing where cilantro tastes like soap? I
yeah.
think I have that with olive oil.
Oh, that's interesting. But just the oil, not
Yeah,
the olives.
yeah, I
Yeah,
know.
that's interesting because that you can get deodorized olive oil, and you know what it is? They put like 2/3 canola oil and 1/3 olive oil, and then that's deodorized. It's still the canola oil. Uh,
Interesting.
it's funny.
Part of the reason, honestly, could be because at one point I tried to make my own mayo and you use olive oil. And I think you were supposed to use extra virgin olive oil, and I used regular and I tried it and I think it was just too much. So that could be why. So there's my little side note for today. Might have traumatized my taste
Well,
buds.
I've done that. I went one time. I went out to dinner. I went on a date when I was in college, and we had Chinese chicken salad, and of course, it has a lot of sesame oil on it. It has a very
Yep.
distinctive odor and flavor.
Yep.
And that night I was sick. I don't know if it was food poisoning from the chicken in the restaurant or what, but I was really sick. And for years, for like 10 years, I could not get near sesame oil. It would just be like, oof, that makes me nauseated. So yeah,
Yeah,
that's
I
probably
think it
that's
is
what,
a thing. Yeah. Okay, but Patricia says, does taking a teaspoon of that help to stabilize blood sugar?
okay. Well, yes, but don't count on that as like necessary. So, for example, if you look at the glycemic index, compare ice cream to watermelon. They have about the same amount of sugar in them, right? But the ice cream has a lower glycemic index, and watermelon shoots up really high. And why is that? Well, because of the fat in the ice cream. And so yeah, the fat that you eat, like olive oil, taking a teaspoon of olive oil with your food, does slow down because why? Because the stomach empties according to calories, and fat has a lot more calories. So fat will slow down the emptying of your stomach, so it empties more slowly. But guess what the glycemic load is? The total amount of blood glucose that's dumped into your blood. The glycemic load is greater for the ice cream than it is for the watermelon, even though the glycemic index, which is the rate of rise, is a lot faster for the watermelon. So So yes, yeah, if you add oil, it does slow down the gastric emptying. But I don't recommend it because you're still adding a whole bunch of calories. And remember, the reason the type 2 diabetes is there is because you're toxic. And toxic on what? And it's calories, it's everything. It's fat, sugar, protein, and whatever other junk you're putting into your body, plastics and whatever else, whatever else is there. But it's an oversupply of all of these caloric things. And so part of the diabetes solution kit is to get away from that.
Okay. Good question here, Rosalind. How do you, Dr. Saunders, deal with stress eating? Now, I just want to comment, Dr. Saunders had admitted to being the one who used to take gum off the bottom of benches and eat it. ABC gum, already been chewed gum. So he's come a long way in his journey, I think, but
But I still stress eat. Yeah. I do. I get stressed. I gotta go eat something, and I go eat something. So how do you deal with it? How does anyone deal with it? I think it's not having things around that are like quick snacks, easy, tasty, sugary, sweet, all that kind of thing. So someone gave me a peach pie the other night, and I was like, I love peach pie. It was freshly baked. She made it at home and everything. So I had a piece, and then I sat down. Then I ate dinner, and then I sat down. And I had another piece.
yeah.
No, when I get stressed, yeah, I go looking for food, and if I have something like some broccoli or some nuts or a cheese, a slice of cheese or something, then I'm okay with that, and I can do that. And so I think the way to deal with it, the way that I've dealt with it, is to choose what to eat instead of just saying I'm not going to eat anything. Just going in and saying, okay, I'm going to munch on something. I got to crunch on something. So I'm going to make celery. I'm going to put some peanut butter in it, and I'm going to eat that.
I remember, now this would be more for people who are in like phase 3, but I remember Dana Cushing a couple of years ago had come on. She works with a lot of people that have type 2 diabetes. She would come on and talk about, she doesn't like to restrict herself. If she's really craving something or really wanting something, she would allow herself to have it. Like if it was a piece of pizza, but she would only have one, and she'd have a salad with it, and she'd eat the salad first and then the pizza, and sometimes just almost getting full on something else before you have the thing that you really want helps you to not overeat it. So something to think about. Lisa says, can you highlight how magnesium affects type 2 diabetes and what supplements are the best?
Okay, there's a lot of magnesium supplements out there, a lot of different types, and a lot of claims being made of our supplements the best magnesium, and ours is the only one that's any good, and all the other ones are bad. But really, magnesium is one of those things that is absolutely essential. And the way it affects type 2 is there is in a lot of different ways. There are over 300 enzymes that require magnesium to function, and many of those are the enzymes that make energy for your body. So the enzymes that are in the mitochondria of your cells, many of them require magnesium to function. So it's not a small thing. It's not like just in one way that it affects the blood glucose. It's a lot of different ways, because if you don't burn your glucose efficiently, if you don't have enough magnesium, then you have to find other ways, and sometimes that causes more insulin to be released, more insulin resistance. So there's myriad ways that magnesium affects glucose, the utilization, and insulin resistance. And so on the other hand, then what kind of magnesium is the best? And there's a lot of hype around magnesium, because some people have made certain magnesium chelated magnesium um, supplements, that the magnesium is bound to an amino acid, and they use a certain amino acid that the body likes to take in and doesn't have any competition with other amino acids, so that the magnesium is brought in easily. And if you look at them, it's like 400 milligrams of this magnesium supplement gives you 120 milligrams of elemental magnesium. Whereas if you were to take a 400 milligram of magnesium oxide, yeah, it's not as well absorbed, but guess what? You're getting probably maybe that 125, about the same amount. Ultimately, it comes out to be about the same. Now, having said that, some people get from the higher dose of magnesium, and they only absorb a portion of it. So where does the rest go? Well, it goes into the large intestine, and some people get diarrhea from that. Some people are really sensitive. Like if they take certain types of magnesium, they get diarrhea because it's not all absorbed. Whereas if you take like a magnesium glycinate, almost all of that is absorbed. So you're very unlikely to get diarrhea from that. And then, at Barton Publishing, we have a spray where you spray it all over your body. And there's a small percentage of that that's absorbed into your body, of magnesium. So there's other ways of getting it. And there isn't the right way for everyone. There's just finding what works best for you. I have people who take magnesium, purposely take the magnesium oxide in a little higher dose because it helps them to have bowel movements every day. It's a stool softener.
Yep. Which is why I don't take it. I don't need help with that. Okay, so if you look here, here's Barton Nutrition. You can see here's our Easy Relief Magnesium. Fun fact, if you use code webinar25, one word, you'll save 25%. I love our magnesium. It's really good. I use it daily. Well, that's not true. Sometimes I don't, but I try to use it daily. I think it's okay to skip it every once in a while. But anyway, there you go. Oh, we're out of time. Okay, I'm going to do one more question. Let's see. Anonymous had said, please clarify for me. I just asked about stopping metformin during your program. Your last statement was that it's not necessary. Do you mean it's not necessary to stop it or to continue taking the metformin at the same time?
Okay. Okay.
First of all, talk to your doctor.
So first, yeah, talk to your doctor. I didn't prescribe it for you, so I can't tell you to get off of it. However, it's not necessary to take metformin to reverse your diabetes. That's the point that I wanted to make. So thank you for clarifying.
And Beverly says, I feel compelled to tout your magnesium spray, which has cleared my skin of bleeding dry spots, among other benefits.
Wow.
Yeah. Well, that's
awesome.
Amazing.
So the magnesium directly, when it goes in smooth muscle, which is the blood vessels themselves, it relaxes arteries and allows better blood flow. So you can expect some improvements in the skin too.
Very cool. And I use it also just because I've had migraines my whole life, and I feel like magnesium does help with that. So, okay, guess what? Time's up. Actually, we went over, and Dr. Saunders needs to go be with his patients. So thank you so much, Dr. Saunders. We'll see you tomorrow.
Hasta mañana.
Come back tomorrow. It'll be our Home Cures That Work webinar. If you are already registered for Thursday, wonderful. If not, go to bartonwebinar.com and you can register for free. Thanks so much for being here with us. I know we didn't get to all of the questions, but we got through quite a few. So I look forward to seeing you tomorrow.